Everyone shades the truth, sometimes whether it's telling friends that color really does look good on her or making up an excuse as to why you were late for dinner at your in-laws. We are always discarding that we are going to say and that we may conceal from others. And it seems time spent in a therapist's office isn't an exception. Clients devote a good deal of their resources, both time and money, to therapy, so what's the inputs for hiding the truth? Researchers say it all depends on the lie itself. For the high percentage of clients who are either minimizing their distress or saying that therapy is going better than they really think it is, it's likely a combination of things. For patients who are hiding thoughts of suicide or drugs use, the primary reason is likely a fear of the consequences if the truth does come out. The same may be true for drug use with patients concerned about being concerned into rehab. We have to recognize that keeping secrets may be a bad thing all of the time. We need to let go of our exceptions that clients shape everything with us. So, what can psychologists do about lies in therapy? In some cases, the best action is to do nothing. The therapist may also find that a minor lie, such as why the client was late for a session, is better dealt with only if it occurs again or is part of a pattern that needs to be addressed. But there are steps therapists can take to keep the sessions on track and their clients as honest as possible. Be upfront about the disclosure process. Clients mentioned that they want therapists to be more active in explaining the process of disclosure. For patients who may worry about discussing any thoughts of suicide, explaining the limits of confidently as clearly and openly as possible can be extremely helpful. Knowing that triggers the process of hospitalization may help those who worry about this step if they have suicidal thoughts. Help kids, patients safe and comfortable by educating them on that may or may not require a high level of care. Ask direct questions. Clients are often willing to discuss almost anything, but may be hesitant to take the first step, especially around a topic they find shameful. In some cases, questions that elicit a simple yes or no response may be the easiest way to move things forward. We may be trying to ask open-ended questions, but this isn't always the best approach. Providing positive feedback when clients are more open is also important, especially when it comes to reduce some of the shame that may be associated with disclosure on topic that may be perceived as taboo. Ultimately, the authors say this will strengthen the relationship between patient and therapist. Acknowledge difficult. Therapy isn't easy, and therapists sometimes need to take a moment and address that fact both to themselves and to the patients. It is sometimes difficult to get to the difficult part. Often it's important to deal with the resistance to the topic before the topic itself. If can be helpful to say we should talk about this more, it feels important, or even I understand it can be difficult to talk about this, let's not talk about this issue, but why it's hard to talk about it. For patients who may be worried that their responses may elicit unwanted action by the therapist, such as hospitalization for suicidal thoughts or recommendations for rehab for an alcohol or drug issue, it's especially important to address these concerns up front. We need to be sensitive about how to address these issues.